I'm here today with Dr. Sinead Dufour, pelvic health physiotherapist, and we are here to talk about mummy tummy. Mummy tummy. So we now know that mummy tummy, which is really an issue for a lot of postpartum women, it is the separation of the linea alba, or those abdominal muscles, that can actually lead to stubborn, loose skin in this area. So women are coming to us with, doing their classes, and they're getting nice definition in their arms and their legs, but they've got this stubborn area in their belly and they want to fix it. So can you tell us a little bit more about what is mummy tummy from a physiological perspective?
Yeah, sure, Nikki. So mummy tummy really is that overstretching of that tissue that you just described. It's not actually the muscles of the abdomen that separate, it's the connective tissue between them. And some amount of stretch during pregnancy through this tissue is normal and won't cause any damage. However, when there's excessive stress on this tissue through pregnancy or in that postpartum period, this is when that tissue stretches too much, and then women are left with that pooching tummy that you've mentioned. And it's very upsetting for many women.
And you've explained to us that you've experienced this yourself with the birth
Absolutely.
Of your twins. So now that we know what it is, tell us, is there anything that we can do to avoid it?
Yeah, there is. So the degree of stretch through a pregnancy, so in my case, how much my tummy stretched having twins, that I could not control. But there are a lot of movements that will create extra stretch and too much stretching on the abdomen. And now that I know what I know, I would have done things differently during my pregnancy. I would not have spent time doing planks or doing yoga on my hands and knees past 32 weeks, which is something I did. I would have made sure that I knew not to do sit-ups, I knew that, but I didn't really realize every time I was getting out of bed, I was essentially doing a sit-up. And so that positioning I would change, and that needs to actually go through right until after you have a baby. Some of those small changes to make sure you're not doing movements that put extra stretch through the abdomen.
So we've talked about how to hopefully prevent some of it. Now, what about someone who is watching this video and doesn't even know if they have a mummy tummy? Is there a way of telling after they have a baby whether they actually have a linea alba or an abdominal separation?
Yeah, there is. It's a fairly straightforward test that we do. And generally the woman lies down on her back with her knees bent. She can place her two fingers just above her belly button as she's lying down and see if those fingers sink down into her tummy. Then she can just lift her head off the ground and see what happens. If the tissue comes up around her fingers and her fingers are in between, then there's a separation. And we can sometimes see how many fingers we can actually fit in that separation. If her fingers actually pop up to the top surface and they're not in between the tissue, then there's no separation.
Okay. And we will be doing some workshops to discuss this and really kind of show people really in person how they can test and how they can fix it, right?
Exactly, because that's what everyone wants to know.
Yeah, how do they fix it? So let's talk about that. How do you fix it?
So there's a number of things you can do. Depending on how wide it is stretched, we can use a tool called a binder, a belly binder, to help those displaced aspects of tissue come back together again while we're doing exercise. The binder itself isn't going to do anything unless there's some action behind the binder. So the binder is something we can use. We have to go back to connecting with those deep core muscles. And we also need to make sure we're very diligent about avoiding those everyday movements that actually increase the stretch through those tissues.
So we've got it all covered here. What is mummy tummy? How do we avoid it? How do we fix it? And how do we tell if we have it? Thank you so much, Dr. Sinead, for being here with us today.
Thank you.